Ready.
Good morning, ladies and gentlemen. We will call to order the Rutherford County Benefits and Insurance Committee meeting, and we need to approve the minutes of the last meeting first. Do we have a motion? All right, Ms. Hickerson and Ms. Boney, motion and second. Did anyone have any corrections or additions? If not, all of you in favor of that, then please say aye. Any opposed? Okay, that's good. Now, Ms. Stinson, let's get a report on our financials.
Okay, if you refer to Fund 264, we will begin with that report. For the month of October, our per employee per month for our self-funded claims experience is $746.18 compared to prior year of $964. For a year-to-date average of $839 compared to prior year of $883. Combining the on-site medical experience, our total per employee per month increases to $785 compared to $1,001 from prior year, for a year-to-date average of $878 compared to prior year of $914. The next sheet included in your report gives you a calendar year perspective showing total revenue of $43,029,196, expenses at $43,198,841 for the current calendar year. Moving on to Fund 266. For the month of October, our year-to-date is $162,280 compared to prior year of $315,810.
Any questions of Ms. Stinson on this good report? Okay. All right. Are we ready to move forward on the workers' comp and OJI report? And we'll call on Mr. Dan Good for that report.
Good morning. I'm here to report for the month of October. In the month of October, we had 15 injuries requiring medical attention. That brings the total for the year up to 156. Of that 156, 105 were OSHA recordable. 65 of those claims had restricted days. 18 had lost time days, and 22 all others. If you look at the next page of your report, you'll see the graph for the last two previous years and this year, just to kind of help you see that. In 2011, year to date, we had 205 claims, while last year in 2012 we have 175, and right now this year we have 155. So we are on a downhill trend at this time. Of the 15 claims we had in the month of October, the total dollars incurred at this time is just over $15,000. The Board of Education has had 5 of those 15 claims, and their dollars incurred is $3,670. The County General has had 10 of them for $11,520. And then the next report, you'll see on the county where those claims are for those 10. And they are divided between the Sheriff Department, Ambulance Department, Ambulance Service, basically. And then the last page of your report, you'll notice the total dollars incurred. And of course, this year, 2013, those dollars have not quite matured yet, so it'll be a little while longer before this year's trend is really reflected accurately, because we've got to close out some of those claims. But we're at about $226,000 compared to last year at $538,000. Are there any questions?
Mr. Good, how many open workers' comp claims do we have?
Right now we have a total of 18. Some of those have been opened in the past, but they've recently reclosed again and brought them back down at this time.
Hey, no questions of Mr. Good. That's an excellent report. If you just look at that last page, I mean, it sort of sends a message of how good we're really doing on this OJI
Yes, sir.
program. If there are no questions, then we'll move forward. Thank you, Mr. Good.
Thank you.
Wellness update from Ms. Kelly Perrion.
Morning. I'd like to give you the wellness update for September and October. We had our September Fitness Challenge, and we had 82 people sign up and 70 people completed the program. Our flu clinic through MedPoint from October 7th to October 31st had 910 flu shots given. 420 of those were given at the wellness fair. At the wellness fair, I've listed out our screening counts, so you can see those. We had a tally counter of 750 people there. We gave 420 flu shots. 205 people did their biometric screening. We had 66 people do their vision, and 82 people did a derma scan. We had 69 people, 69 employees participate in 5 or more screenings at the wellness fair. For September and October, the MedPoint Clinic one-on-one coaching had 39 active patients with 56 total coaching visits. And our current and upcoming activities, the community center at John Rice is having a Season of Wonders on Thursday. It's like a homemade crafts and goods fair. They're having that from 9:30 to 2. We're running a Health for the Holidays Wellness Challenge. It just started this Monday, and we have about 100 people signed up for that. So it goes through December 16th, and just is going to help our employees focus on staying healthy during the holidays. And our Life Services webinar for December 17th is Path to Inner Peace, and it is online. On the next page, we have provided the September Fitness Challenge program outcomes. And like we said before, 82 people registered, 70 people completed the program. They had to report their exercise logs and do a post-evaluation survey, and we included the survey results on the front and back of this page. We were really excited about the first 2 questions. The question 1 says, before the fitness challenge, how much exercise were you getting? And only 29% of people reported they were exercising 120 minutes per week. And after the fitness challenge, 70% answered that they were exercising at 120 minutes or more a week. On the back, it gives you some remarks that the participants gave, just that they were given extra motivation and team accountability. So we're really happy about the outcome of that. Anybody have any questions? Ms. Paula?
Ms. Barnes?
Question, and this may not pertain to wellness as much as Ms. Stinson. On the biometric screening that we're requiring for next year, do you have, or is there a way to track the progress that's been made with our employees that are the primary source in the healthcare plan and how we're doing with that?
I received a test file from Cigna so that we could review the data as it would be presented to modify the system. That was in October, I believe. Is that right, Mr. Huffman, when you sent that to me? And it had about 1,500 individuals that had completed it at that time,
Out of
5,300.
We have a long way to go to meet that goal of 100% of our employees that
Right.
are follow-up information sent out to everybody.
Well, we will not identify specifically those that haven't completed and reach out to them, but we will, as once we get into December, we'll send out some reminders. But they've been more than poised to be successful at this with multiple communications, including mailers to their home. But we will assist a couple more times with emails.
And what's the time frame that they need to have this completed?
February 17th.
February the 17th, so we will remind everyone. Okay. Any other questions of Ms. Perrion?
This is my first time going to the health fair, so I toured it and, observed, and I want to thank you and your staff, Ms. Stinson, for putting it on. Looked like it was very well attended and very nice, so thank you.
Thank you very much, Mr. Marlin. Good. And thank you, Ms. Perrin, for a good report. We could just get a few more than 82 to participate, increase that to 820, we'd really be that's where all of us need to be. Okay, thank you very much. Next, we have on the agenda some discussion regarding our flexible spending accounts. And Ms. Stinson, are you going to tell us about that?
Yes, sir. At the end of October, the U.S. Treasury Department announced a change in the use it or lose it rule as it pertains to flexible spending. Currently, we had the option to either allow employees to have a grace period or not have a grace period, and we currently allow that grace period to occur. And what that means is an employee can incur and file for reimbursement on cost through 2.5 months of the following calendar year for which elections were made. So as an example, in 2012, they had until 2.5 months in 2013 to file any remaining balances in their flexible spending account for reimbursement. Reimbursement is eligible for qualified medical expenses. What the U.S. Treasury has said is that we have the option now to modify our program to make it more liberal in that we can allow a $500 balance to carry over through the entire calendar year the next year. So someone who enrolls in 2013 or is enrolled in 2013 that currently has a $400 flexible spending account balance, if we make this change, rather than them having to have the balance depleted by the middle of March, they would actually have through the remainder of the calendar year next year to deplete that $400 that they had remaining from their 2013 contributions. What happens when an employee doesn't deplete their balance is that they forfeit that money. So there's nothing that the county contributes on their behalf into the flexible spending account. It is deducted from their payroll and put into an account that they can draw from. By making this change, we are just making it easier for employees to ensure that they don't lose any money that they have contributed into the flexible spending account. So the recommendation to the group is to modify our language effective with 2013 to adopt the new Treasury guidelines to allow the $500 to carry over through the next calendar year as defined by the U.S. Treasury. Now, this only is for the medical expense reimbursement. There's also a dependent care, which pays for child care and things like that, and that rule was not changed as part of this update from the U.S. Treasury. So we would only be changing those eligible medical reimbursements out of the flexible account.
Ms. Harvey.
Okay, currently what we have is that if you have until the middle of March to make your claims. So like in 2014, we would have till the middle of March. But the actual spending of the money, the actual service, has to be done during the year 2013 because that's the calendar year that we're working on. Is that correct?
Now, the grace period actually carries over to the middle of March, so they could incur something in January.
And it would still
And
carry
it would still be
over.
deducted. Yeah, that's correct.
So if we change this to do a whole calendar year, what you're really doing is whatever you select to be taken out of your check to go into flexible spending, you would actually have 2 years to spend that amount of money.
That's correct. You'd have that additional 10.5 months for a total of 2 years, correct?
And that service that you're paying for can be anywhere in that 2 years.
That's correct. And if it's only limited to $500 as a reference, so someone who has a $1,000 carryover at the end of 2013 can carry over $500 and they would lose $500.
Mr. Sandberg, were you having some other clarification that would help us?
He was just working along the conversation.
Okay.
I had a question. What happens to the
Mr.
money when they forfeit it? Does
It goes into the insurance fund, right?
But
The
it
county
all
is
county
also.
money, though. It is all employee money because it comes out of their paycheck, correct?
That is correct, but I do want to point out one thing. There is a shared risk on flexible spending accounts. As an example, someone who signs up for a $2,000 flexible spending account in 2014, as an example. Let's say they go to the doctor January the 15th and has surgery, and they deplete that $2,000. And then they resign in April. Because we evenly space those $2,000 deductions out throughout the year, when they resign in April, we've only collected a portion of that $2,000 from their payroll. The county then has funded that remaining balance to get to the $2,000. So there is a give and take between the county and employees.
Okay, Mr. Chief Gammon.
Question I got that Commissioner Jordan just asked, makes me think now maybe there's something the city can do. Let's say somebody has spent X amount of dollars and they resign, they're going to get a final check from the county. Is there not some way you can seek the reimbursement of that final check?
No, not per the guidelines.
Is that fair, Randy?
Yes, it is. Yeah.
Okay, we've had this discussion. Mr. Sandvik, she can't make a motion. We'll let her speak first. Ms. Nolan.
I was saying that this account is separate from the insurance fund. The flexible benefit is a separate fund from the insurance, and it's the forfeited monies that help pay and offset the one.
So I'll give you an example, just, because I like numbers. For 2012, our employees deposited into this flexible account that Ms. Nolan just referenced $718,306. The forfeited amount, I'm sorry, let me back up, was $608,372. The forfeited amount was $3,751. So we're not talking about a large percentage of the contributions that actually end up forfeited. But as I look back through here, there were several examples where, just as I explained, we had pre-funded and then the termination occurred or whatever through the employment. And so there was a give and take. So that 3,000 plus is really a net of both of those numbers, what employees lost and reduced by what the county had funded as well.
Okay, Mr. Sandvik.
How often do you have someone carry something over $500 over to the next year? Any idea?
Yeah, I looked at all of that. Rarely. I would say of the, and I'm just ballparking, but I did go back and look at it, majority of them was less than 500. There was 480 that participated in 2012, and I would venture less than 10 people actually carried over more than 500. Yeah, it's not a large number.
Okay, do we have a motion on this?
I got a question. What's the industry trend on this? I know the Treasury Department has done this, but what's your experience or what have you heard?
My experience has been that people have generally allowed the grace period to occur. This just was introduced at the end of October, and I assume that most employers will probably choose to evolve to that as well, but that's just my perspective on it.
Okay. I'll make a motion that we pass it.
All right, and a second from Ms. Hickerson that we extend the grace period for the full year following the plan year that they're in. It seems like a win-win for the employees.
2013.
That's effective for this plan year of 2013, so whatever they carry forward at the end of this calendar year will go forward. They'll be able to spend it next calendar year. Motion and a second. Any other discussion? All right, everyone in favor of that then, please say aye. Aye. Is anyone opposed to that? All right, that's carried unanimously. Now, under item 6, pre-65 retiree premiums, I think there's probably 2 separate items of sort of for discussion here. So Mrs. Stinson and I think Mr. Jay Brown may be going to help her with this. So do we start with him on the first item?
He can just come up and interject as he sees fits. So there's several documents clipped together that you'll need to refer to. I've tried to make this as organized for you as possible. The first discussion opens an old discussion that I know that you all probably cringed when you read this document. This goes back to our GASB and when we modified the retiree language and that you all began several years ago. The first two categories reference those individuals up to 7 years of service. And in reviewing the next item of discussion, a review of this document was completed as well, and it was identified that when the document was adopted, it was originally set that the county contribution that we will be making, the defined contribution of either $300 or $500, was intended to go into a health savings account. What we know is that that's not permissible based on the intent of why that information was adopted. It's my understanding that this body adopted that language because we wanted to provide either $300 or $500 defined contribution to a retiree so that they could then make their own health care choice. They could either use that contribution and remain on the county insurance, and if the premium was $1,000, we'd give them $300 or $500 and they would be responsible for the remaining balance. Or they could go out somewhere else and get their insurance and take that money with them in order to pay for that premium. A health savings account does not allow for you to just provide that type of stipend and it not be attached to certain requirements. One of those requirements is the type of insurance plan that the health savings account is associated with. In order to achieve the goal that was originally set forth, we need to modify the language. And I've provided you with language on the attached document that looks like this, of how it needs to read in order to accomplish the original goal. Currently, the language, as an example, on less than 6 months of service reads, the county will contribute $300 per month or the adequate rate, whichever is less, into a health savings account established by Rutherford County for each eligible retiree. All medical plan benefits will end with Medicare eligibility. The recommendation is to modify that to read, county will provide a $300 per month stipend or the adequate rate, whichever is less, as a taxable income. All medical plan benefits will end with Medicare eligibility. What this enables us to do is to accomplish the original goal of giving them $300. They can either then stay on our insurance and use the $300 towards that adequate rate premium, which was $1,000 in the example I gave you. So we would give them $300, they would pay $700 out of pocket. Or they may choose to go on their spouse's insurance, to go to the exchange if that still exists at that time, to go through another private insurance plan. And it was my understanding that that was the original intent, and we can't get there based on the way the language was originally adopted. So we're making the recommendation to modify the language for the less than 6 months of service and the 6 months up to 7 years of service as written in the discussion number 1 item that's been presented to you.
Okay, you have questions on that? It's the same amount of money that's being transferred, it's just making it appropriate.
Right.
That they can then use it as they choose to stay within our plan or a plan they may or may not choose to purchase on the outside of our plan. Ms. Harvey?
Okay, just to clarify a question, this was passed by this committee in December of 2010, and it was on these two different groups. So if we change this language, will that go back to those people that started the plan in 2010, or will we start this in January of 2014?
The eligibility stays the same, so that's 2010. The benefit is what is changing, and really the benefit's not changing, it's how we're distributing the money that's changing. But the eligibility is still the same. So when someone calls our office and says, what are my benefits under retirement? We're going to look at, on 12/31/2010, where were you? We're going to put you in the box that you fall into, just like we're doing today, and then you'll have the benefit as outlined on this document.
Mr. Sandvig?
This is essentially a technical correction.
It is, that's right, that's correct.
I would like to make a motion to approve.
All right, and we have a second from Mr. Jordan. All right. A motion by Mr. Sandvig and a second by Mr. Jordan to approve the technical correction of the language here to accommodate and change and accomplish the original objectives. Any other discussion? Okay, everyone in favor, please say aye. Aye. Any opposed? Okay, so that's good. All right, we'll continue on with the second piece of your discussion regarding retiree premiums.
This same sheet that you were just looking at for reference, discussion item 2 is outlined on the second page. There's also additional documents that you'll need to refer to for discussion. The first looks like this. This is current premium structure for 2014. The other two are these large sheets. There are 2 of these, and I would point you to the section here, which is pre-65, and what you will notice is the difference in the county contribution. On the first sheet, you'll see that the county contribution for copay and deductible single is 65.5. The family is 63.5. On the second, it shows the 50% contribution. And Mr. Brown will walk you back through these again in a moment. And the last sheet is healthcare reforms illustration that we will be discussing and providing to you today. So as we reference each of these documents, I wanted to just acknowledge to you which page we were pertaining to. So if you'll recall, as we went through the discussions of premiums for 2014 back in the spring of last year, there was a desire of the committee to try to ease the pre-65 rate increase, which extended beyond 100%, and the impact to those pre-65s. So we did a couple of things. One thing is we added a 50% rate increase versus a 100% rate increase, and Mr. Brown will talk about what did we do with that remaining balance so that we had a full budget. The other thing that we did was for 1 year, for those individuals who are in a pre-65 retiree status as of December 31st, 2013, they are eligible for a higher county contribution for 1 year. Typically, we contribute 50% on pre-65 retirees. We lifted that county contribution for 1 year to the different amounts shown, which is 65.5% for single and 63.5% for family. That was a 1 year concession that allowed us to offer that relief to those pre-65s and get us to the discussion that we are beginning today. So today, our discussion is for 2015 premiums. Not what the premium amounts will be, but how those calculations will occur. And we have proposed for you a couple of different options that we'll walk through, which we have outlined in the sheet for you. And if, Mr. Brown, if you'd like to kind of elaborate on what I've just said, then once you're done with that, we can go through the various options on our proposals for 2015 premiums.
Essentially, when we reviewed last year, I mean, obviously we were faced with a big rate increase. And so when we looked at the actives and the retirees were running worse than the actives as far as a percentage. And so the decision was at that time, when we looked at it, do we put the retirees on a standalone basis and make their rate self-sufficient? We talked about doing that, but it required really 150% rate increase to this retiree group that was on obviously a limited income. And so that was a big initial kind of discussion we had for a few months. But at the same time, at that particular time, we didn't feel blending the rates made sense, because if we blended the rates with the actives and the retirees, then that was going to cause the active population to have an even larger increase than what they were already faced with due to the budgeting for 2014.
Mr. Brown, I don't want to lose along the way. So when he says blending the rates, basically if you look at that sheet right now, we have 3 sets of rates. We have active employees, we have those rates for pre-65s, and then we have those post-65, our Medicare participants. When he says blending the rates, what we would do is take all the experience for the actives and the pre-65s, combine that, and determine what the budget needs for that group as a whole would be. That's what blending the rate means. So then you would have one premium. And if you'll remind them what happened whenever we did that during the last review, that would be helpful.
Right. So we looked at a couple options. One was blending the rates so that everybody had the same rate. And then what we were kind of faced with was trying to figure out what the contribution percentages would be. With that, we've got the option of going back to the 50% there. But when we blended the rates, essentially that did raise the cost to everybody. But we knew that the retiree class had a higher claim projection. So that was the concern there, is we were raising the cost of the actives. In actuality, last year, what we finalized, what we ended up doing, there was $1 million that essentially the county largely absorbed to not pass on the needed increase to the retirees. And that's when we said this was a one-year decision based on where we were with that projection last year, and the already large increase was to essentially absorb $1 million needed increase to the retirees. But then as soon as we get through the renewal, start that discussion again this year of how do we really want to handle that for 2015. So when we looked at it, essentially at this point, as we start going through these options, we absorbed $1 million last year, and then as we go through, one of our proposals this year is really making that rate the same for everybody and then setting the contribution structure. Even then, we are looking at potentially passing on $775,000, an additional $775,000 up to the actives. Now, granted, that's a much larger premium projection, so as a percentage, it's just a couple percentage points. But that's really kind of, as we talked last time, some of our surveys, when we looked around at some of the other counties, what they're doing, most of them have decided that blending the rates makes more sense because we have a small percentage of retirees as a whole, and we've gone back and looked through the years, the claims do fluctuate. So some years the claims go up, some years they go down. So it does appear from an underwriting perspective, it might make sense to have all those claims together because as a whole, Rutherford County, the actives, which is, several thousand, couple thousand employees, their fluctuation's more like this. Because the larger the group is, the less the fluctuation of claims.
So we have 165 pre-65 retirees. We have 3 recommendations, or 3 options we'd like to present today. One of them is to keep the historical premium determinations as we have in the past. And by that I mean keep them as their own independent category. We know it's not sustainable because it is such a small population. We would expect to see another increase next year within that population. We know that on an active employee costs us about $5,000 a year in claims. A pre-65 cost us $9,000 a year in claims. And that's that's just claims. That has nothing to do with premium contributions, anything like that. So that would be one option. The second option would be to blend the pre-65 retirees with active employees to determine one adequate rate for this group. The county contribution in that scenario would remain at 50% for pre-65s. So we would determine the rate, and perhaps let's use as an example that rate is $1,000. That's adequate rate. We would pay $500. The pre-65 retiree would pay $500. Now that $1,000 rate in a blended scenario would also be the adequate rate for an active employee. But an active employee has a higher county contribution than a pre-65. So you would not have the same out-of-pocket premium for both groups. You would just have the same adequate rate. Okay? And that is what was asked of us last year. We chose not to do it last year because when we blended those rates, a lot of our pre-65s got a premium reduction. What it also does for the pre-65s when you blend the rate is it takes it from 2 tiers to 4 tiers. Right now we have a single category and a family category for our pre-65 retirees. When you blend the rate, they would go to 4 tiers, just like our actives. You would have single, employee or active or retiree plus spouse, active retiree plus children, and then family coverage. So they would see some type of relief in that as well, because if it's just them and their spouse under a blended rate, they would have a lower adequate rate than what a family rate would typically carry. And the last is to provide a county subsidy of $500 per month or the adequate rate, whichever is less, to those classified as pre-65 retirees and allow the retiree to leave the county plan to obtain coverage elsewhere. So, what we're recommending is an adoption of option 2 and 3. Through that, what it allows a pre-65 to do is to either choose to stay on the county insurance using a blended rate, or it allows them to shop the market. Perhaps they're married and they could get on their spouse's plan. They could take the $500 a month that we would pay as taxable income and use that to help offset the premiums that their spouse incurs through their employer and pay other medical costs that they have. They would be allowed to leave once, and they would remain off the county insurance as long as they remain classified as a pre-65 retiree. At the point that they turn Medicare eligible, they have 30 calendar days to come back to county insurance, at which time they would be classified as post-65, and they would start paying their portion of the post-65 premium rate. If they don't come back within the 30 calendar days, then they have lost county benefit. What this does is it gives this category of folks who are still young enough to work elsewhere, who have other options probably available to them for health care, the opportunity to go explore those options. The way it's written right now, they don't even have the opportunity to do that, because once you leave the county plan, you can never come back. So we are limiting their ability to find something that's more cost efficient for them, and that would also be cost efficient for the county in most instances. Using the current Affordable Care Act, Mr. Brown, can you walk through that example for them so they can see how that would work?
Yeah, what we've provided, as Ms. Stinson said, they have several options available to them, but one that really hasn't been explored until now, obviously because the exchanges were just made available this year, and this is something really for 15, so we're hopeful, given another year of the exchange, that maybe they can get on and enroll by then, but at least as an option, as consultants, we have access to what the rates and the subsidies are. And so what we put together is this illustration just to kind of show you guys as one example, because obviously we don't know what their employers would make or their premiums would be, but we do know what the exchange offers retirees now. And this is an example really of a single retiree household income of $28,500. So we have to show what the income would be, we have to show what their age would be, and then a plan they would choose. And so as we kind of look down through here, we have a single and a married family unit. We just said the married would make the same income, so we multiplied that by 2 at the $57,000. And then we looked up on the exchange a plan similar to what would be available to them today under the county plan. So obviously we have some limitations of what we can offer. But this particular plan that we selected through Blue Cross is $1,000 deductible, 80% coinsurance, the $4,000 out of pocket. It does have copays in there for office visits and prescriptions. So you can see the assumptions box has under C what the plan design would be. And then we also have to assume an average age. So we have to assume an income, a plan design, an age, and then tobacco, non-tobacco. And we assumed a 55-year-old as our illustration. And when we look at this, there's 2 boxes below the assumption. One's for an individual that does not use tobacco, and then one that does use tobacco on there. And then we show it for a single, if the retiree just wants to go out to the exchange and look at coverage for themselves, or if they want to go out and look at coverage for them and their spouse. And so when we look through this, based on that income level, those assumptions, the actual premium for a non-tobacco user is $639 for single, or employee plus spouse, it's $1,278. Based on those assumptions, they would be eligible for a federal subsidy under the plan, under the exchange plan. So that's kind of listed depending on 1 or 2 people covered under the benefits. And so what comes out to be then is the net cost to the retiree. And so the net cost to the retiree under the first example is $500.57 or $1,073. So this would be what the retiree would pay for a similar plan listed above. And then the goal would be is that the county would offer them the $500 to go towards that benefit. So if this was the example, that retiree could go out to the exchange, get this similar plan, and they wouldn't have to pay anything for coverage because the county would be subsidizing that additional $500. Whereas today under the plan, if you go back and look, they're having to pay a couple $100 out of their pocket for that similar plan. So this is just one study. Like we said, there's multiple ways they may be able to use that $500, but this is one that we can kind of show as an example. For tobacco or non-tobacco user below, you can see the rates are a little higher. So if they were a tobacco user, they would have to pay $96 potentially for that same plan.
So a couple of points on that as well. We worked with Ms. Stevenson and Mr. Sandvig to acquire the average TCRS monthly income for our population. Knowing that majority of our retirees are certified teachers, this $28,000 actually reflects their average monthly income from TCRS plus the $6,000 a year that we would give them. So worst case scenario, based on this information, for a majority of our folks, because if you'll look back at the big colored sheets, most of our folks are on our single coverage for copay pre-65. So worst case scenario, our highest income, assuming that they only have TCRS, they would be at a net cost of $500.57. So when you start looking at county general, the classifieds, highway, those who have less monthly income from TCRS, you would assume, Mr. Brown, that the subsidy would actually go up and we would see that $500 number go down. Is that correct? So in that scenario, as we're giving those individuals $500 a month, they would be able to pay their insurance premium and have monies remaining to help pay any additional medical costs that they have during that month. Prescriptions, co-pays, things of that nature.
Ms. Stinson, is it possible to separate the discussion on whether we're going, first of all, are we going to blend the pre-65 retirees with the active employees and then talk about the subsidy, or do they both have to go together in the same discussion?
Our recommendation is to adopt two of the recommendations. We do not believe that leaving them as a separate entity is a long-term strategy that is sustainable. We do feel that blending is consistent with what other employers do, what our surveys have shown, and it provides more sustainability for the pre-65 category over the long haul. So we think that blending, as well as allowing them the option to have this subsidy, is the best all the way around approach. It's good for the pre-65 retiree. They get the best advantage in having the blended rate, as well as you can see from this example here, going outside even to somewhere like the exchange shows an option that would lower their overall premium cost per month as well.
Let's go back to the blending discussion just a little bit more here. And I think I heard you say, or Mr. Brown say, that if we do blend, we know that the experience that we have with the pre-65 retirees is the costs are greater, so it's going to push more costs back into the active group when we blend. So that's a given, sort of here. Okay, so that's point number one. Point number two, we're on a plan that continues to reduce every year the percentage that the county is participating with on the active employees. So we're going to push another 1% to them again next year or whatever. Okay, so both of those points will tend to continue to, I guess you could say, accelerate the additional cost at the active people. So is that a fair statement?
That is a fair statement. It added a couple of dollars to their premium for 2014. But if you recall, Mayor, in prior discussions, what we've heard back from this group is that based on their discussions, some have commented that their active employees would rather pay a couple of dollars more during the course of being an active employee to have lower premiums whenever they are actually
later on.
Yes, sir.
Okay, so that's Ms. Stevenson.
Two questions. Because they have, under healthcare reform, I want to make sure that I'm understanding this, because they have the option of an insurance available to them, would they be fined if they went to the exchange? Right, because currently, if I understand it correctly, under healthcare reform, if a person has available insurance through their employer or through their spouse, if they go to the exchange, they have to pay a fine. Would they have to pay a fine because they have available insurance to them?
Retiree language, if that's different for an active person versus a retiree, the employer could face a penalty. So that's potentially what I need to look into from a retiree's perspective. I don't know if either one of you.
My only concern was because if we were blended with the active population, it may infer that. So that was my first question.
For purposes of tracking the liability, however, we will still have to go through the process of, on the backside, we will actually be determining what their adequate rate will be as a standalone group, because we'll need that for liability purposes, for finance, and then we'll be presenting the blended as for just premium collection budget needs.
I just wanted to make sure
They were
that
an active,
one or the other wouldn't have to pay an additional fine because it was available.
If they were an active employee and they had coverage available and they went out to the exchange, then the employer would potentially have a penalty. But I think because they're a retiree, it's different, but I will look into that.
And then my next question is, if they opt in option 3 to take the $500 subsidy, and once they turn 65, who will be responsible? Will we notify anybody who's getting a stipend, hey, you're about to turn 65, you have 30 days from this, or are we leaving that totally up to the pre-65, that once they turn 65, it's their responsibility?
There would be administrative functions around this, where we would have to do annual verification, those type of things as well, yeah.
Ms. Nolan?
Just thinking through the math, because in the end, it does affect the unfunded liability in the ARC. Is that right now, when you have a retiree, you're paying, let's say, the 50% of their premium. When it's blended, and you're putting into a blended rate, the active employee is paying more. The county is paying 80% at some point of that rate. So the county is still paying that portion for the retiree. It ends up, when you go back through what I would request that you prepare for this body also is what that adequate, not just for me, but for the group to say this is how much we are contributing toward those pre-65s.
Yeah, we would be able to do that, and I think Mr. Brown's already alluded to next year, it's going to be somewhere around $775,000 under a blended scenario.
This year, when we talked it through, is largely the county absorbed the $1 million. And so what we're doing here is saying blending the rates really so that each year we don't have to have a retiree discussion because of the claims fluctuates.
I mean, I understand where we're going, and I know it's an easier pill to swallow.
Right.
The back end is that the county is
It's the same thing.
It's the same thing.
You're incurring the $1 million. It's over at $750, and the employees are doing the other $250.
Just gets hidden in
Right.
the active rate.
That's right.
What the county is paying and what the employee is paying.
Right. The only thing we're doing is, like I said, evening out the retiree rate, but the county is still absorbing that cost, just like we had the budget discussions last year. Somebody's got to pay the cost. We're just really kind of even out the retiree rate and doing the same thing we did this year. The county's going to absorb the large chunk of that amount, not the employees. The other option we talked about is passing it on the retiree, which didn't seem to be an option that was too favorable.
Mr. Brown, can you use these spreadsheets to kind of walk through what you've just said, where you can show what it looked like when it was 50% and then what it looked like when it moved to 65? Because they'll be able to see how the budget needs for that group changes as well, and that gives them
I think you have one exhibit that I have is what was actually sold. So the one that we actually finalized is listed, and then the proposed. And so really, there's a lot of numbers on here, but if you go through and look at the retiree portion at the bottom in orange.
So this is the one that was finalized. It has that yellow bar across the bottom. That way you know.
So the finalized retiree in orange down below, if you look just in the pre-65s, well, let's look all the way down to the bottom. The total, let's see the best way, the total premium for the retiree portion at the very bottom says total annualized in gray. For 2013, total retirees paid $1,546,000. See that? And then what actually happened was we passed on to the retirees $1,671,000 for 2014. So they did incur the increase. And then next to that, you can see the county portion. So the county went from paying $2.2 million to $3.1 million. Follow me there? So that's kind of where, when we split the 63 or 65 or 63% the retiree was paying, where it was 50% before, and the increase, you can see there that the county took on a big chunk of that increase difference. All we're really saying now is if you go to the blended rate, so that's the difference there. If you go to the blended rate, make sure I've got the right blended rate here. What we did here is then we showed, what we didn't show before really, I think, is we did talk about with Ms. Stinson the rates. Look back at the top, the single plus spouse plus child and family, and we broke out the enrollment. You can see, based on last year's renewal, the 2014 renewal, if you look at the retiree portion, as we said before, how that would affect each of the tiers. So one of the things we were concerned about was several of those differences in premium. The third column of the retiree portion shows decreases for singles. There's a pretty big increase for the family. It's $235 for the copay plan, and then the deductible plan is $274. But there's only a couple people in those plans. So when we start looking at dividing the rates into the four tiers like the actives, one of the big concerns is with such a big increase last year, we didn't really want to see those decreases. So you can kind of see that. But when you look at those rates now divided by the four tiers, I believe you guys have a yellow column a little further over to the right. The yellow column now shows the same rates as we were kind of walking through just to kind of get to the math. But $512 in the yellow column for single, that's the exact same thing that an active pays at the top. So now we've kind of blended those rates so the rates are exactly the same. So if you look all the way down in the retiree for 2014 at the very bottom, the total annualized, we now need right at $4 million. It's blended. So $3,999,000. If you look back at the one we were looking at before, that number was 4.775. So the total premium needed is essentially $775,000 less. And so that premium, then you can kind of follow the numbers. I know there's a ton of numbers, but essentially that number right there, you can see it went from $4,775,000 to the blended rate of $3,999,000. So that's the $750,000 that's going up to the actives because it had to show up somewhere. So if we did that same math with the actives, you would see the active number actually went up $775,000 above. Now, as it relates to the county or the retiree, that would be the green and the orange bucket. And so if you follow that difference there, you can either look at two things, the difference column or the 2013 proposed, but you can see there under the blended, the county under the retiree piece only pays $137,000, and then the retirees only pay $67,000. If you look up under the actives column above, the one that goes further across to the left and right, that difference shows up in those columns. And so to Ms. Nolan, I mean, if we go down and sit through, you'll see that, like you said, the $750,000 gets put up into the number above for the actives, and then because the county pays most of that premium, that's why when we looked at it, the active employee cost only went up a couple dollars because the active employees only pay 10% of the cost. So 90% of that cost ends up into the retiree bucket. So we thought this was a viable option last year. It just didn't feel right to have retirees have a reduced cost in that year when everybody else in the county was getting an increase. But it is saying, that the most of that cost is going to the to the county, which is what's been happening in the past. We've kind of haven't realized that they needed the increase and haven't really looked at it in that way. And what happens is the county was paying the cost anyway. And that's how our reserves were going down. So these are the spreadsheets that we'll just look at going forward each year, so you'll be able to see how the budget works and how the increases need to be.
One other comment, Mayor, before you say, I'd like to add one thing that we didn't reference, and you may have, Mr. Brown, I just didn't hear it. If we decide to make a decision today and to adopt the stipend, we gave the example of healthcare reform. The other piece I want to let you know is that it would not be our intent to expect the pre-65s to navigate the healthcare exchange alone. There is individuals at Cowan Benefits that specifically focus on the exchange, and they would be available to consult with the pre-65 one-on-one, help them with the application process, and eventually help them to secure whatever plan that they would like. So we would add that additional resource there as well.
Okay, he said quite a lot there, and it's all on these 2 sheets of paper here, but some of us may have a little bit of time trying to actually follow that. Let's see if we can summarize that. On the first big sheet, the one that we're currently operating under, if I go all the way to the bottom of the page, on the 2014 proposed employee portion of the additional cost was $1,671,000. And if you blend the rates, it would be $1,614,000. So the employee portion goes down ever so slightly. Okay, then the county portion on the proposed is $3.1 million, and with this blended rate, I'm still down at the very bottom, is 2.3. So the county is having to pick up how much? Around $700,000. So it's obvious that the county is going to pick up more with this blended approach. I mean, that's the simplicity of looking at that bottom line. Is that correct? Okay. And I just want to remind you, I mean, and then let's go up to the top where you said the couple of dollars as all these active rates are increasing, I suppose, is what you were saying. So you're saying even with these additional costs that the actives are going to pick up and the county's picking up, the rates that we're going to be experiencing for the actual individuals is, well, if I look for employee plus family, for example, on the copay plan, it went from $190 to $193, so really just $2 more.
Yes, sir.
So it's nominal changes there, and the county portion actually went up from $1,276 to $1,291, so it's about $15 on the county side of it. So the county's picking up most of this additional cost when we blend these rates. And I don't want any of us to think that there's any real probability of us not reducing the county's 87% to 86%. I don't think we should go there with any discussion. So be prepared to move forward with our plan. Okay, now other questions. Ms. Nolan and Mr. Sandvig.
That the pre-65 plan is, as far as benefits, is the way it is today, where vision and dental is not a part of it?
We don't have any proposed changes in the plan for pre-65s.
Okay.
Mr. Sandvig.
Question, concern, are we potentially incurring any liability penalty-wise with the retirees? Would it be appropriate to hold on item 3 until our next meeting when we have an answer on that?
Approve the blended, that's the bigger piece for starting the renewal discussions, because next meeting we're going to start the renewal part of it. How we do the subsidy and the stipends really is secondary. It was more to help the retiree and to help our future liability. So I think if we want to do it in steps and approve the blended and then talk about the second part later.
Yeah, I think it's our sense that it doesn't pertain to retirees. It's only for the active employees based under the question that she gave, but we'll be glad to go back and confirm that. Yeah. So we could do it one of either, we could do it a multitude of ways. We could adopt it the way it's proposed. We could adopt one portion of it and review it for additional consideration. To me, it's cleaner for the multiple committees to do it all at once. But we will need to know, as Mr. Brown said, next month is best to allow us to begin looking at the rates, because we start in February. You know, once we get January experience, we start premium discussions for 2015, so.
All right, so we could adopt just recommendation number 2, independent, and hold up on number 3 till, what, you think we need to do that next month?
Or you could suspend discussion to the next meeting
Or we could
and just make one
do
motion
nothing
for
until
all
next
of the
meeting.
premiums.
Okay, you could go ahead and approve the blending of the rates, recommend the approval of the blending of the rates, or you could, and wait, that means you would wait until next meeting time to continue the discussion about the $500 per month subsidy, or we could, Ms. Stinson said we could just not do anything today and handle both of them next time. Or
I'll know tomorrow.
Or
so
you
we-
could prove it all with this assumption that there's no penalty to the pre-65 retirees and move on.
It has to go to the commission, does it not?
Yes, it does.
I
I would
mean,
rather take it once.
We could pass both of these with the, with it known that if there is a red flag comes up, it circles back here next month. That gets it in the pipeline. I'm getting a little bit of deja vu here because we just had this discussion the other day, it seemed like, and it wasn't palatable to blend these rates, as you said, and give a lesser premium in some cases to the retirees when the actives are fixing to get beat up. And I'm not so sure they're not going to get beat up again next year, so it's easier to do this broken apart. But they're just separated by a few months, and we just happen to have all that conversation in one sheet. So, I guess this probably has to be done, but nothing's changed from last year. All the facts are still there. We didn't want to, give to one and take away from the other, but we wouldn't do it last year. We probably ought to do it, but I just want to make sure everybody realizes that this is the same discussion we had. It's just not both of them on the table at the same time. But with that, I'll make a motion to approve both and move it forward. And if there is a problem, it just come back next month.
Second, Ms. Hickerson. Discussion? Ms. Barnes?
I just need to say that we have an obligation to our 4,000 employees and to our Board of Education to share this information. We've received a wealth of information today, and I think that we need more time to take this to them to make sure they understand what we're walking into. I agree, the recommendations are good, but we need to share this with them, and I know this is a public meeting, but we need to have that face with our employees too to present this information. So I would ask that we defer a vote on all of these recommendations until we come back in December or at our next available meeting.
Ms. Barnes, you're recommending that you could make a motion to defer, but right now we can just take your comments as a recommendation, okay? Mr. Jordan?
I no disrespect to Ms. Barnes, but if we need to make a policy change, if we, get too far into that we don't take any action until second month to give it time to get through all the different processes. This will go to budget, will it not? And then on to commission, so there will be time for feedback from the school board at that time. But that could be said about every single thing we bring up. Well, we've all got it. Now let's go look at it. And all of a sudden we're going to be having 2 meetings a month and get farther behind. And so I think we should go ahead myself.
Our budget meeting, Ms. Nolan, budget meeting will be what date in December? The 5th? The 5th. So the next discussion, if there is feedback from any group or the teachers included, we could certainly bring that forward at the budget meeting. Mr. McAdoo, excuse me, sir, I didn't see you.
Thank you. I think I have to agree with Commissioner Jordan. We need to move forward on it. Now, if we are looking for feedback from over at the Education Department, we do have an Education Committee, and they can give the feedback to them prior to our next meeting. So it is a way they can give feedback on their employees' favorability of his program prior to the next meeting through that education committee.
There is a second opportunity, you're saying there as well. Other questions or discussions? Mr. Marlin?
Yeah, I'm sorry. I just got a question on the spreadsheet just to make sure. I just kind of want to drill down to an individual person to see what the blended rate, if we approve this, what would it go to versus what it is right now. So I'm looking at the 2014 premium proposal, the blended. Excuse me. I'll tell you what. Let's switch over and look at what we have right now, if I understand right. And if you look at the copay plan, employee and family, they would be paying the difference, right, the 282.11 column there, difference in premium. I don't know if you're where I'm at on that or not, but
Yes, so essentially, if the copay plan, a single employee-only person today pays $50.60, see that number?
He's on the employee plus family. The 282.11 is the employee contribution plus the county's portion. Those two together is 282.11.
Yeah, and
currently.
Then that's right. That's what they'd be paying currently. Is that right?
Between the two of us, yes.
Yes, and then if we approve this, it goes to $299.54 on the other sheet. Am I looking at that right?
Yes, sir. I think so, Ms. Stinson. $299.54.
Yeah. So that's about an $18 increase or something like that, a little less.
17 plus.
Okay. So I mean, I'm just trying to compare apples. So if the difference is $282 and then goes to $299, if we approve this blended plan, about $18, and that'd be for a family, employee and family on the copay plan.
Correct.
Okay. I'm just trying to get some comparison. I mean, I know we're looking at the big numbers on the county, and I'm just trying to think from an individual perspective that is what the premium increase proposed anyway. We don't know for sure, right? But that's
based on the 2014. So what we're
Yes.
trying to get is the formula, and then here in another month or so, we'll be talking about the rate increase or change for 15 minutes.
right. Okay, thank you.
Wait,
I want
it
to back
wasn't
up, Mr.
282.
Marlin, because I'm not following your numbers. I want to make sure that if you look at the sheet for, and again, all these discussions are for 2015, and we don't know what those premiums look like. But using 2014 as an example, looking at the blended sheet, so at the very top it says 2014 premium proposal, blend, active, and retiree rates. So looking at that sheet, you will see that the total proposed, which is that yellow column, shows for an individual on the copay plan at the very top, which are our active employees, a total proposed adequate rate premium of $512.03. If you go down to the pre-65, you'll see that on the copay single, it's $512.03. Now, under the current contribution, a county employee would pay $51.20 a month, but a pre-65 would pay $256.01 per month because the contributions are different. So the total rate is the same, but the contribution level is different. So I'm not sure what column I couldn't quite catch up.
He was looking at the difference in premium column.
Yeah, I just wanted to see what an active employee would be paying now versus if we blended the plan, what the proposed would be, to see what they're looking at as an increase for a family.
Right.
So today if we look at that same, it's $51.20. See, today they're paying $51.20. If we go to the blended rate, well, no, actually, today it's the
$50.60.
and they would go to $51.20.
Correct.
So that, I think that's
Yeah.
He was looking at the combined
Right.
piece plus
Right.
the employee piece. The difference is going up.
Right.
$17.
And just one comment to Mr. Jordan. Part of the problem last year was the amount of increase that we needed inside of the pre-65s. They were at 150%. We weren't nearly that high with the actives. That's what pushed a lot of those costs. So we would need to see that ongoing trend for rate of increase. And even at 150%, we had not seen that level historically. Now, they've needed higher increases than the actives, but not typically to that level. So hopefully we wouldn't see such as big of a gap as what we had seen in the past, but we'll know here shortly, that's for sure.
Okay, we do have a motion to recommend the approval of the options 2 and 3 that have been presented to us there. Other discussion or questions? If not, then we're ready to vote. So,
We need to do a roll call vote on this one.
all right, we'd like to do a roll call vote. I've had a request for that, so Evelyn, would you please call the roll?
Paula Barnes,
Roll call vote.
Roll call vote on what you,
Susan Boney, Mayor Burgess,
yes.
Elizabeth Crace, Commissioner Ely, Virgil Gammon, Greg Hall is absent, Regina Harvey, Mary Hickerson, Commissioner Jordan, Ricky Marlin,
Yes.
Commissioner McAdoo, Joe Russell, Jeff Sandvig. Ten yes, 1 no, 2 abstain.
But thank you very much now. Thank you, Mr. Brown. Is there any other business that we have here that anyone wishes to discuss? Ms. Stinson?
I've got a question.
Burden?
I feel the pain of the representatives of the Board of Education, the Highway Department, and the Sheriff's Department. The rest of us, we can kind of figure this out as we get here, but would it be possible to get those that are represented in these other departments, this paperwork a little bit ahead of time to give them time to go over it with their superiors and all? Because, I mean, I can understand exactly where Ms. Barnes is coming from. If she could have got this spreadsheet 3 or 4 days ago, she could have at least passed it by the superintendent or whoever, you know, and stuff. So I don't mean to put more work on you, but that would make it a little simpler in this room, because now they've got to go back and report, well, what did you see? Well, we've saw it and we've already voted and stuff. So I just ask if I could be a little bit of a change.
What happens is you're ratcheting down our ability to do a thorough review. Because, as an example, it's November the 19th. Our next meeting is December the 19th. So as these things come up that we need to discuss, review, develop, those type of things, I will basically have 2 weeks to analyze, make decisions, prepare documents, and get them out the door. We modify and continue to work on this stuff a lot of times up to the last minute. This morning, not because we are delaying it, but because we are continuing to massage and make it the very best that we can. Now, sometimes it's ready a couple of days ahead of time, but not in all cases. And so, and my other concern about, I will do what is requested, but my other concern about sending out information without explanation is then you get a lot of bad information in circulation. And that is another animal in and of itself. And so I will do whatever the wishes are to the best that I can, but I think that you're exchanging who's being positioned the most unfavorably, and I feel like it's shifting now into my department and the consultants, because we won't have as much time to do adequate and thorough review if we are required to release it a week early. Because it's not going to be a couple of days. It's going to have to be much more than that in order for them to circulate to their board.
Mr. Sandvig?
Well, and I liken this kind of to the budget process that we deal with for a long time. And I utterly realize in the budget I give to our board members earlier versions, and they're disclaimers, realizing I will probably be making changes until sometimes the morning of that meeting. But I think I hesitate to speak for our board members, but I think this recommendation that did pass today, our board members will like. But if we could have had, just enough warning to run it by them, I don't think Ms. Barnes does, it answers the concerns they were expressing last year, and I think they will like it, but we have to run it by them. So
I'll do whatever's asked. I will comment to the fact that last year, I do know, having reviewed some of the tapes, that the board didn't receive the information about the premiums until the May meeting. Now, they may have off camera, but the comments on the tape was that that was the first time they'd heard about it, but we had had months of discussion. And so, you know, I don't know what the right solution is, but I do know that some of the frustrations do stem from the timeliness, and I understand that. But there have been instances where the information has been out there as well, so I don't know what the right answer is here. I'll do whatever's asked of me. Just know that we'll do the best that we can and get it to you as soon as we can. But I need direction. I need confirmed direction, Mayor.
Okay. I don't think we're in a position to really give you hard direction, but you've heard the discussion, and I think we'll work together to see if there's any way. When there is an opportunity to present the information ahead of time, we'll do that. If there's not an opportunity, we'll have to work together to communicate effectively. Mr. Marlin.
Yeah, I mean, just being a new member of the committee, I've got some observations. I think in this particular situation, maybe now, maybe you could come up with some high point bulletin points to hand out to the department heads to go forward now so that they know what's going on. But, you know, in the future, I mean, it still has to go through 2 more committees before it's finalized, and that, to me, that's the review period as well for employee feedback, public feedback, and that. I know we don't want to go through a bunch of revisions and I think you alluded to that with Mr. Jordan, is, you know, we want to, you know, have a one-shot deal here, but I mean, that, to me, that's kind of the review period as well. I mean, we don't. You know, you can use the analogy of the tail wagging the dog here. You know, we want to you got to make a recommendation first before we know what to do. So that's just my outside observation. I don't know if that helps or hurts, but if you could, my recommendation on this particular right now is maybe just a bullet point to the department head so they can go over that with their departments.
Actually, you got a 3-committee review: web committee, public safety, budget, and then the commission. So we got 3 opportunities to look at this before it's being finalized in the commission. In which, if you got any feedback from employees or what, it can go to the education committee or the public safety committee, and go to budget. And then it can be brought up by our department head or the insurance department head in the commission meeting. So I think that's sufficient.
One of the things that we did do is we added the board to the school board to the distribution of the agenda. We could add an explanation as to what the item is as well. I know that since doing that, I get phone calls to just say, what is, you know, tell me, answer a couple questions and things like that. So I know that at a minimum we could add that explanation and, you know, maybe give a better understanding as well of what we're looking at.
Ms. Nolan.
I think I'm sharing some of your concern when we take from this committee and we put it out to the population and say, this is what the insurance committee has approved, but that recommendation can change a couple times before it ever gets to the commission, but it's in the employee population that says, but this is what you said you approved. I mean, I think that's where I think you're coming from, is that you get too much. Only solution I could see, if on your website, if there was a separate thing that says, this is, you know, even your minutes, or these are the highlights, this is what came out of our committee, and leave it at that, instead of hitting departments, because usually when department heads get it, it's like, oh, this is what
the minutes are already out there today. We already do publish those out there. But you bring up a good point, and use the biometrics as an example. Even when it's decided and it's published and it's put in writing, they don't read it. We still have individuals with bad information that they have chosen to somehow gather or determine through some other means other than what's been published in front of them. Take open enrollment as an example. We even went to the level of saying, there's no technical support over this weekend. Make sure that you've checked your login, that you're able to get in. Miss Barnes and I were working Sunday night. She was sending me emails. I logged in from home. I was doing technical support from home on Sunday night because people had waited to the last minute. So it does, when I look at the population of my department of 7 people, and really only 4 of them are dedicated to insurance, and I look at how things evolve and the level of emotion our employees freely demonstrate to my department, it does bring me a lot of concern that we are going to be creating a lot of work for my department that's unnecessary if we distribute information too much. But we can try and modify it and see what we need to do to make sure that this body's best prepared whenever you come to the meetings.
Okay, I think we've had a healthy discussion. I think all of us can look at these sheets of paper here. I mean, and it's really hard enough just to understand what's on this paper. And the effort it takes, I just really want them to take all the time they need to be sure these numbers they put on these pieces of paper are accurate. And I believe this is a complicated, extraordinarily complicated process, so because we don't want to have to come back and say we made a mistake on this. So they need all the time they need to be sure the data is very, very accurate. So, but I think we're doing a great job overall. So thank you. Anything else you want to bring up? Mr. Sandvik?
And I, working with spreadsheets all the time, I greatly appreciate that effort. Yeah, I want the best numbers we can have when we come to vote on anything. Absolutely. It's just sometimes some preliminary information could help a little on our side, because our board members have on several occasions made it very clear to us they want to be aware of what's going on before we vote.
Okay, thank you very much. If no one else wishes to discuss anything, we are adjourned. Thank you very much.